Hello, and welcome to the Natural PCOS podcast, the podcast dedicated to empowering women with polycystic ovarian syndrome through natural approaches. I'm your host, Dr. Samina Mitha, a naturopathic doctor with a passion for women's health and hormones. Each episode, I'll explore the latest insights and my personal experience to help you manage your PCOS naturally. Together, we'll dive into practical tips, inspiring stories, and the latest research to support your journey towards balance and wellness. Let's get started on your path to thriving with PCOS naturally. Hello, everyone, and welcome back to the Natural PCOS podcast. I'm your host, Dr. Samina Mitha, naturopathic doctor. And today's podcast is all about fatigue and PCOS, one of the most common symptoms when we see PCOS, but I would say one of the more overlooked symptoms, just gets put kind of under the rug, right? Because of all the other big symptoms associated with PCOS. A lot of women with PCOS will come in and say they're exhausted, even after a full night of sleep. They wake up, they can't get out of bed. And really, we're going to unpack why this happens, why there's this fatigue, the root cause behind your fatigue, and natural strategies to finally get your energy back. I just want to share a quick story before we begin. One of my patients had come in, skipping breakfast, drinking coffee, just because she didn't have any time. Or the other reason why was because she was feeling nauseous in the morning. And what we did was we really tried to just push her body to eat something. Even though she didn't really feel like she wanted to eat and wasn't feeling the greatest, we fixed her sleep. That was a big part of her case. Circadian rhythm can really throw off how you feel in the morning. And we made sure she was getting enough protein during the day. And finally, when she came back, she was like, yeah, I have so much more energy. I can get up now. I don't feel like I have to have a nap in the afternoon. These are big, big changes for her. So let's talk about why fatigue is so common in PCOS. The biggest, I would say, cause or root is blood sugar imbalances, right? Insulin and glucose really can affect the way you feel throughout the day. We always want to try to balance these two things, insulin and glucose. When we have blood sugar spikes and dips throughout the day, this can really cause energy crashes, and it can actually feel like your body's running on empty. The signs of this could be cravings, shakiness, irritability in between meals. I call this feeling hangry. Ask every patient this, and we laugh about it because a lot of times, women are hangry with PCOS, and so we want to make sure we're balancing that blood sugar. And, stabilizing that blood sugar throughout the day actually really helps to allow the body to have steady energy throughout the day. And a lot of this has to do with how you're eating. So we're going to talk about what you can do in a second for that. Another cause is inflammation and oxidative stress. We know women with PCOS have low-grade inflammation, and it's really important to address this because it can cause fatigue and brain fog. We really want to focus in on, are we eating processed foods? How's your gut health? Is there any dysbiosis there, meaning there's more bad bacteria than good bacteria? Is there leaky gut? Are you actually feeding your digestive tract foods that flourish and give energy and proper information to all of your cells? We want to look at environmental toxins that might be present in your environment, and of course, stress. Stress is probably one of the biggest causes of inflammation. What we can really focus in on is making sure we get anti-inflammatory foods like omega-3s, that comes from nuts and seeds, fish, colorful vegetables, turmeric. All of these can really help. Polyphenols like berries, for example, are really helpful to reduce inflammation. Another cause is hormonal imbalances, especially that elevated testosterone and even cortisol can really impact your energy. Low levels of progesterone or even your thyroid. We do find that women with PCOS have an increased risk of hypothyroidism. And one of the major symptoms of hypothyroidism is fatigue and exhaustion. They feel like they're dragging themselves throughout the day. Stress is incredibly important. And when we balance cortisol, we find that our hormones actually get better because of that. And now we're actually able to make the estrogen, the progesterone, all of these hormones that help us to ovulate. Another big cause of fatigue is sleep quality. I can't tell you how many times a patient will come in and one of their goals or their biggest goals is to lose weight and regulate their cycles. which is completely fair. Those are probably two of the biggest symptoms when it comes to PCOS. And when we dig deeper, we find out that they are not sleeping well. And that's actually where we really want to start. We want to work on their sleep so that their circadian rhythm is fixed, so that when they wake up in the morning, they actually have energy to cook their meals, eat their meals, exercise, get through the day without literally falling apart or feeling like you're running on adrenaline because you're just drinking coffee to get through it. So when we fix sleep, we support cortisol, we give maybe a little bit of melatonin to fix that circadian rhythm. It really can impact every single thing when it comes to PCOS in a positive way. And last but not least, one of the biggest causes of fatigue is these nutritional deficiencies like iron, B12, magnesium, vitamin D, even coenzyme Q10. This is probably one of the most powerful antioxidants in our body. It's involved in creating ATP, which is basically energy production in the body. We have the most amount of coenzyme Q10 in our brain, our heart, and our ovaries. So just think about that, right? If you need a lot of coenzyme Q10 in that ovary, and we know polycystic ovaries is common with PCOS, it's really important to support that with maybe this antioxidant. And oftentimes what we find is that lab work will look completely normal, and you've been told, hey, you know what, you're fine. Even though you're tired, your lab looks great, so you should be okay. But no, if you look at the person in front of you, that person is extremely tired, can't get through the day, using caffeine or whatever it is to get through the day. And the biggest thing we need to focus in on is looking at the person in front of us as a doctor. And what I find is that oftentimes patients are being told, oh yeah, your iron is at, 20, that's fine. Even that's the, maybe the cutoff of the reference range. Your B12, yeah, it looks normal. It's at, 200. That should be perfectly fine. But I find that it needs to be greater than 500. Your vitamin D, your vitamin D is at 75. Usually in Canada, the reference range is between 75 to 250. If you're at 75, oh yeah, you should have no problem. You don't need to take vitamin D. You're completely fine. But then when we try to optimize that level, we get the vitamin D above 100. We give a little bit of vitamin D. The patient feels so much better. There's many times that I've given a patient vitamin D and corrected that deficiency, and they come back and say, yeah, I finally feel like my energy's back, and the only thing I've changed is my vitamin D, which is great. Now you know the reason why you've been so tired, and it's not just all in your head. Let's talk about stress and the adrenal function. Chronic stress, just feeling like you've always been stressed, maybe, university or college or studying or anything has many years of stress. Then you go to work, lots of stress through that, and you just constantly feel like you're wired but tired. This is extremely important to address because when we find that cortisol is imbalanced, this can make a big impact on your energy throughout the day. Ideally, you want your cortisol to be a little bit high in the morning. This is what helps us get us up, get us going. Slowly drops throughout the day, and at night it has to be at its lowest amount. We often find this is totally reversed. Patient will wake up, they're not making enough cortisol, they can't get out of bed, and then at night, that's when all of a sudden they start making cortisol. And now they can't fall asleep because they're just so wired on all this cortisol that they're making. So we need to really help support that, and I'm going to talk a little bit about adaptogens in a little bit. So how do you assess for fatigue on lab work? There's many, many labs to do, but I'm going to go over a few. Fasting insulin, fasting glucose to really look at blood sugar imbalances, HbA1c, this is glucose over the last 3 months, your full thyroid panel, TSH, free T3, free T4, and anti-TPO. Ferritin, which is your storage form of iron, and hemoglobin on a complete blood count, your vitamin B12, your vitamin D, also potentially a cortisol panel through urine metabolites or saliva, or even just checking AM cortisol in the blood might give you a little bit of an idea of what's happening. So the other thing you really want to do is track your symptoms and patterns, when the energy dips, when you have the most amount of energy. Is it morning, afternoon? Are you relying on coffee throughout the day? This will also help to guide you on what the root cause could be. Okay, so let's talk a little bit about natural strategies to boost energy when it comes to PCOS. Of course, the first thing is to balance blood sugar. Never, ever, ever, ever miss your breakfast. This is probably one of the most important meals of the day. Even if you're doing intermittent fasting, stop eating earlier. Like, for example, stop eating in the evening and wake up and still eat your breakfast. Super important. Make sure you're eating protein in every meal and healthy fats and fiber, so vegetables. It's extremely important to manage blood sugar. Never forget these 3 items on your plate. Make sure you're not having these massive gaps in between your meals because this can really impact blood sugar. We talk a lot about the food plate for PCOS in my practice, and it really depends on what your lab work is saying. But generally, you want to make sure you have some kind of protein size of your palm, at least 2 cups of veggies in that plate. You want to make sure you're eating enough healthy fats. This is something that most people miss, and fats are needed to make hormones, really important, and reduce inflammation. So really make sure you're not missing those healthy fats. And then carbohydrates really depends on the person in terms of what their fasting, insulin, fasting glucose is to figure out how many carbs this person can actually tolerate. So next is supporting sleep. So we talked about how sometimes cortisol can be high at night when you're trying to fall asleep, and this blocks melatonin production. So what we do is we maybe give a little bit to support that cortisol, bring it down. We give a little, maybe 5-HTP or L-theanine and a little bit of melatonin so that your body can fall asleep and stay asleep. Magnesium is really great here, or even like herbal teas like chamomile, lavender. You really want to make sure that you are focusing on good sleep hygiene. You're getting into bed at an appropriate time. You're dimming the lights. I'm really intense about the lights. Every day, I'm like, at night, 7 o'clock hits, I try to dim every single light in my house and make sure that it's a calming environment because that can really affect your melatonin production. And then, we want to address nutritional deficiencies. Iron, especially if you have pretty heavy cycles or low ferritin on your blood work. B vitamins, really helpful to support the adrenal glands and for energy production. Even magnesium. We know magnesium is involved in so many reactions in the body, so really important to give that magnesium. Vitamin D, really helpful for fatigue and hormones. We know we have vitamin D receptors in our uterus, so incredibly important to make sure you test it and get the appropriate dose for your body. We want to reduce inflammation by focusing on things like berries, leafy greens, turmeric, omega-3, fatty acids in our diet. So we're talking nuts and seeds here, avocados, good healthy oils. We want to reduce sugar. Sugar is probably one of the biggest things that causes inflammation in the body. Alcohol and processed oils, especially oils, support gut health to reduce inflammation, making sure we're maybe taking some probiotics or supporting the gut through other things like bone broth or kombucha, kimchi, these fermented foods, kefir, that really help to support gut microbiome. Another thing we want to support is your adrenals. So meditating, deep breathing, box breathing is really great. Deep breath, 4 breaths in, 4 breaths hold, 4 breaths out. Even just gentle exercising like walking, in journaling, something to just help your body process all and everything that you've gone through throughout the day onto paper can be really helpful to your adrenal glands. We want to use adaptogens sometimes for women with PCOS who are really struggling with the energy and the fatigue and the cortisol. So things like ashwagandha, eleutherococcus, 2 totally different herbs. Eleutherococcus can really help support energy levels, ashwagandha too, but you really need somebody to help guide you on which one is best for your specific case. And restorative activities, really stopping if you need to stop, not using more coffee, and instead actually slowing down if you have the chance. I know a lot of times work and life can get in the way, but really try to listen to your body and rest if you need to. Exercise is incredibly important when it comes to fatigue. It can increase insulin sensitivity, and it can really help support inflammation, stress, and balance blood sugar. Everything we've talked about today. I have an exercise podcast in a previous episode, so go back and listen to that one. But even just gentle walking, yoga, strength training 3 to 4 times a week can be really helpful. Now, to give you an example of a fatigue case in my practice, kind of goes back to what we talked about at the beginning. My patient who came in wasn't eating breakfast. She was feeling a little bit nauseous in the morning, but when you really feel nauseous in the morning, a lot of times it's due to your sleep. So we gave her something called Somnipro. It really helps to calm the cortisol, give her a little bit of melatonin, and then her sleep got better. We put her on magnesium too to get her into deep sleep because she was waking up throughout the night. Now she was waking up feeling much better. She started eating more. And even I'll encourage patients who feel this way to just eat nuts and seeds or one hard-boiled egg, anything that they can stomach, get down in the morning so that they don't feel tired later on in the day. When she started doing this and focusing on protein in lunch and dinner, her energy got much better. Another thing we really focused in on with this patient was making sure she got enough vitamin D because her vitamin D levels were low. Finally, she felt like she actually had energy to get through the day. We didn't, move from, a 4 to a 10 out of 10 in terms of energy, 10 being the most, but we did push the needle a little bit to help get the energy up. And as she keeps on going with managing blood sugar throughout the day and adjusting her diet, it's only going to get better from here. So, fatigue for PCOS, I don't think it's just a part of it. I think it's a sign that something's off and we need to dig deeper to really figure out what could be going on. Fatigue is actually really a symptom that we can fix. We can find the root cause and we can fix it, especially through diet, lifestyle, and supplementation. I really encourage you to listen to your body rather than just pushing through the exhaustion and find out what the actual root cause of your fatigue is. And if you've been struggling with low energy, I want to tell you that I know it's not all in your head. Once you support your hormones, your blood sugar, and your sleep, your energy can actually come back. Please share this episode with somebody who struggles with fatigue and PCOS, and follow me on Instagram or my website, saminamitha.com, for more natural PCOS resources. Stay tuned for my next episode on hair loss and PCOS. See you soon. Thank you for tuning in to the Natural PCOS podcast. I hope you found today's episode insightful and empowering. Remember, managing PCOS is a journey and you're not alone. For resources, tips, and to connect with our community, visit my website at saminamitha.com. You can also find me on Instagram at dr.saminamitha.nd. If you enjoyed this episode, please subscribe, rate, and leave a review. Your feedback helps me to reach more women seeking support for PCOS. Until next time, take care and stay well.